competition. And if you don't like market competition, you're in a different country than I seem to be living in right now.
So join me in thanking the panel. Didn't they do a great job?
Yeah.
Thank you very much.
Let us thank David Klein and the panel. Thank you very much for outstanding and thought-provoking presentation. Last but not least, we have a great presentation on futuristic technology coming up in this minute. Basically, everybody hears about how artificial intelligence is changing the way medicine is going to be practiced and how it's going to revolutionize the way we do make decisions as clinicians and as managers. One of the cutting-edge efforts internationally is the Watson project run by IBM Corporation. For some of you who don't know, IBM is the largest private employer in New York State. It's a major operation. And our next speaker, Dan Palino, is a general manager at the global public sector of IBM. Dan has advised many government officials around the world. He's a frequent contributor to the public sector dialogue. He appeared many times on ABC, Nightly News, CNN, BBC. He was interviewed in USA Today, Wall Street Journal, New York Times, Washington Post, Bloomberg, etc., etc. Dan has basically developed within the last 6 years a phenomenal structure on IBM healthcare activities, and he brings to us unique perspective on how big technology, big data is really going to revolutionize the way we're going to deal with healthcare. We're also grateful for his support of the conference and for taking time from busy schedule to come speak for us. Dan, please come over. Thank you very much.
Hi, everyone. Thanks for staying. This side did, so thank you very much. This side's out of the way. I'm between you and the end, and so I'm so glad to be here. A couple of observations sitting in the back. I just love the debate. So regardless about what people feel about, Republicans, Democrats, whatever it might be, literally the debate is just spectacular, and I think we're all better for it. It's been a privilege and honor to be here with you. Thank you, Avi, for inviting me. Dr. Dorsey, thank you. I am a Rochesterian. I grew up in Fairport after leaving Gates early on, and I get a chance to come back and work with the University of Rochester very regularly. And just recently, IBM honored Rochester with a Smarter Cities grant. It's about $500,000 of work that we'll do together to get after informatics in the region. I'm excited about doing that. And then also at the University of Rochester, we did a couple of other things that were noteworthy. One is we put a high-performance compute center at the University of Rochester to help exploit many of the patents, the wonderful patents through Kodak, laser technology, et cetera. And we continue to add jobs, up to 900 so far together collectively within the region, within Rochester, which is great. And then probably interesting to this topic, when we announced Watson, I had this idea to do case studies, to go to our best schools, business schools, and then challenge the students to say, what do you think about this thing, Watson? And then we created literally stipends. We built teams. There were 7 teams. David, who just hosted for you, was one of our leaders that helped us think about how we should honor these kids and listen to what they have to say. And it was out of that conversation where I thought, wouldn't it be interesting to have Simon Says, right? The Simon Business School, Russia. Simon Says, Watson, do this. And what came out of that is probably a phrase that I think literally changed the tone and tenor about how Watson has been presented. And that is to fall in love with the question, not the answer. And so literally, as you hear and I talk to you today, and we talk about how Watson and advanced analytics can help us solve some of the great mysteries that are out there, it is that quest to fall in love with the question, not necessarily the answer, because as you'll see, the technology is there to help us find these kind of answers. It really gets back to us to start asking some questions. A little bit about IBM and a little work that I have responsibilities for. In healthcare, first of all, I do sit at the table of care that we buy for our people. We're number 5 in the U.S. with how much we spend, over $2 billion. All of our people get a chance to go to their primary care physician without a copay, and we move 12% of our population at 4 or more comorbidities down to 6. So we have a very large population that spans not only the world, but for sure in the U.S., so we get a chance to try different programs. We have a Fitbit challenge going right on with steps, and I'm happy to tell you that my group is winning with over 10,000 steps. We only have until May 31st to go. I don't think they can catch us, but anyway, if you see anybody that looks like they work on my team out there, they're not goofing off. They're trying to win the Fitbit challenge with steps. I also lead the advocacy work, so I've had a chance to, with the kind introduction, thank you very much, I do get a chance to spend time on the debate and on the dialogue and the global discussion. Interestingly enough, we did send Blumenthal over to Denmark. So the conversation about can you export, et cetera. And Denmark does some wonderful things. He came back to me and he said, Dan, I loved everything I saw, but you realize it's only 5.5 million people. That's a very small region, you know, with what we deal with. And with that, Blumenthal came back and said, look, I believe healthcare is regional for the most part, kind of the conversation we were just getting into. So I'll resist the temptation to get into all the conversations that we just had, but I will tell you that the voice that you haven't heard from is the person that pays 170 million of the lives of 330 million. That's the large employer. And so I'd love to be able to engage with you on what the large employer expects. We've left that voice out of this conversation. I'll resist that temptation, but we pay the bill. We're self-insured. We spend $2 billion. And the large employer's voice needs to be heard here because there's an awful lot of discussion that has to happen about do they go to the exchange or not? What are we looking for? What are the new metrics? And if we're going to pay for it, shouldn't it be the experience and how quickly they can get back to work? Shouldn't those be the elements by which a large employer would say this is where I want to put my people when they get sick and ill? And shouldn't we have a voice about primary care in the medical home? And shouldn't we have a voice with what happens after care? So I would encourage us to continue to have the dialogue we're having. I'd just like you to slip in the large employer, which represents 170 million voices and people in debates like this, because it is an ecosystem that's supposed to make it work. So my topic, my 30 minutes, is really around Watson and some of the work that we're doing. And what I thought I'd do at the time that we have is show you two videos. One, an introduction into Watson. I'll make some comments about use cases and where we're working and what we're seeing so far. And then I'd like you to hear from our chairman. She was just recently on CNBC talking about some of the work that we've got going on with Watson and our commitments. It's about a minute long, but you'll see the commitment that we're making and investments within healthcare, within health, and some of our most advanced technologies. So, guys, if you could run the first video, it's about 3 minutes.
Watson has spent the last couple of years in healthcare doing amazing things, helping pharmaceutical companies and universities find new drugs. It's been working with doctors to literally learn healthcare and come back and help advise doctors on what they might do in terms of treatments. Now there's an explosion of devices also that's generating data.
Those devices are going to start to capture enormous amounts of information about us as humans. They have capabilities that are going to fuel a data explosion. That data explosion is going to fuel the next generation of health and healthcare. What if we're able to connect that information directly back to your doctor? Over the last 2 years, we've really focused in on delivering new healthcare solutions around Watson. We're going to extend that capability to our new Watson Health Cloud. We're going to have a new analytics platform called Watson Health Insights that extends the capability with dramatic new research analytics that will enable us to build whole new solutions in a secure environment.
We will build the most secure cloud to handle this information. We will strip the identity of the individual from the data to ensure the privacy of the individual. We'll be able to apply our massive scale cloud technology, our highest security, and deep analytics such as Watson will put these capabilities then in the hands of the healthcare providers, the doctors, the nurses, to be there instantaneously helping them make better decisions.
The hope is to have an open innovation platform, if you will. Institutions can come, leverage such platform, leverage the analytics, leverage all these insights that could be derived from their data in order to better cater to the needs of the patient.
With the amount of information that's being produced, IBM is one of the only companies that can put together that secure, safe, cloud-based environment to ensure your privacy at a scale that will enable researchers, doctors, providers, patients, and consumers to access all of the information.
This complete platform really is a first, and I think is going to transform healthcare.
We're excited about the launch of the healthcare division because it allows us to grow this ecosystem in even broader and deeper ways. Just as we saw within the first year of Watson overall, I am sure we will see thousands of new use cases coming our way, and it'll give us a chance to really extend the reach of these cognitive services into new places.
We're going into things like wellness, working with different partners, and we're going into helping researchers in drug discovery, going into clinical trials, both from a patient perspective and how we match patients to particular trials, and helping to advance clinical research in that way.
We have an opportunity to truly get to places and to people that other people couldn't get to today.
I think we're really primed to make a lot of advancements in healthcare, and there's been a lot of demand for it.
I'm very confident that we are starting something major and big and transformative in healthcare and life sciences.
I think in the end, when we look back, Watson will be disease's worst enemy.
We're going to really change healthcare on the face of the planet.
So I think you're probably all familiar with Watson. We debuted it with Watson playing Jeopardy, and then from that we continued to go forward, and then we rolled it out first of all industries into healthcare. Some things behind the scenes: 40% of the corpus that we had that played Jeopardy actually was built around healthcare. And the reason happens to be that so many of the questions in Jeopardy, believe it or not, come through a health or a healthcare or an environmental aspect that we found that this would work. So our chairman, she grabbed me and she said, Dan, you have to launch, you have to find the right clients, you have to figure out how to do this. And so one of the areas that we started with was Memorial Sloan Kettering. And I'm going to give you 3 use cases. We have many use cases. And then show you another video, and then with the time we have left, hopefully take a few of your questions. This gets back to the scale conversation to some extent. Memorial Sloan Kettering is about ready to have a planning session. Their business development executive that works for the CEO calls me up and says, Dan, can you help me think about what we should do differently? We have the cliff coming up in 2017. We don't like the way things are going, and we'd like some help on how we could potentially do something different. So we talked about longitudinal data, what they have around cancer, some of the areas that they can focus on, thoracic cancer specifically. And I said, what happens if we apply this most advanced technology into what you already have of these multiple years of longitudinal data? And you can do 3 things. 1, you could create a network by which you could allow other delivery systems to participate with you. Number 2, you could do the Glenn Steele work with Proven Care and create a PDF file and try and sell it for $1 million. Number 3, you can actually have your physicians go out and proctor and go out and participate in that model. He says, perfect, let me try it. So he had a conversation with the CEO and the executive team. They said, let's go ahead. Many people looking at structured, unstructured data, building it here. If you've ever seen the presentations that Dr. Chris does, they're just phenomenal about how they change their practice patterns. And just recently, they sold that idea to one of the largest hospital systems in Thailand that now covers over 1 million patients. So not only did they improve what they were doing, but they were looking to be able to expand into new revenue aspects and be able to build on some of where they felt they had some competencies. We're now going into other cancers with Memorial Sloan Kettering, and if they were here, I think they'd tell you, hey, we're doing a better job with delivering on treatments, and we've also found a way to be able to expand our business model that makes sense for us. Number 2, MD Anderson. MD Anderson had a chance to take a look at what we were doing and said, can we throw it up against blood diseases? 6 specific blood diseases, and within the first couple of days of us working together, they said, we want to make a proclamation. We will reduce the amount of time it takes for a positive outcome from 3 years to 18 months, and we're going to announce that we're cutting deaths in half. Deaths in half. And so now what you see is actually if you fly into the Phoenix airport and you were to come with me there, you would see how Banner has teamed with MD Anderson, specifically in blood disorders and cancers, again, expanding what MD Anderson does, helping build their practice patterns, putting some discipline behind it where they've seen the benefits, and they get to expand their business model. Another example of how a large organization says, let's look at it. Mayo. At Mayo, we did clinical trials. Interestingly enough, 170,000 clinical trials happen at the point of care. Mayo does the majority of those, 8,000, of which they were just taking way too long. Patients were having to stay at the hospitals and the hotels waiting for whatever information. Often these would take 3 months, from 3 weeks to 3 months. They said, can we apply clinical trials at the point of care and reduce the amount of time from discovery to treatment to a positive outcome? And that's what we're doing with Mayo. So when you saw that announcement and you hear what Mayo is doing, it's a quest to try and do what Mayo does well, and that is when you show up at Mayo, you're going to come back out with an answer faster than you do any place else, and we'll help the most dire conditions. And that's in the quest of what the Mayo brothers started, and that's in their DNA, and they feel that's part of what Mayo does. I have many use cases within healthcare, and we have many more that are lined up with. We just bought Explorus, and we bought Vitel. The interesting part about Explorus, there's 26 open APIs that allow us to feed in huge data sets, and so now we have 92 million patient records that are available to us to be able to look at, mine, and be able to set up data sets, rich data sets that we can explore. Vitel gave us a cloud, a HIPAA-based cloud environment on population health. If you think about the challenge that we have, it can be as simple as this. Before with population health, during acute and episodic, and after care. And we've spent the majority of the time so far on this revolution that's happening, evolving the during, looking at disease conditions, trying to shorten hospital stays, trying to look at infections, looking at work patterns with nurses, look at the inefficiencies. We really haven't done a lot on the front end on population management. It's great to have 23andMe and others come forward and do this work, but there hasn't been anything that really codifies that to help really change things different. The senator was talking about old geezers, we've got to change something, et cetera. Some of your researchers that are here that you brought forward, I was sitting in the back, said, Dan, can you help us get at these data sets where we can be predictive about what has happened to a generation over time and change it before it happens? And we can. And we can. These are things that we're working on. And then aftercare. What are we going to do about aftercare and wearing devices? We all know a fall is not a fall. A fall is not a physical activity. It's a neurological activity. It's an indication that there's something that's going to happen with another event. Why can't we have those type of devices that someone that might be in that kind of condition, and we recognize it's a neurological event, and again, get them the right care so that they don't fall and break a femur or break a hip or whatever it might be that actually leads them to a potential very bad situation. So these are the things that we're working on. I think we can take things that are very complicated, look and ingest significant data sets, and out of that be able to deliver better care, better outcomes, reduce time, and in many situations create tremendous business opportunities for our clients and many of the providers, the health plans, and make a difference. So I've gone by this pretty quickly, but I thought you'd like to hear from our CEO. She was just about a week ago talking about what we're doing, and you'll see her and hear her commitment. You'll actually hear her talk about some of the references I just mentioned to you. So can we run the second video?
On this topic. Let's talk about what you're doing right now with Watson in the healthcare business, because I think that's really exciting.
Yeah, and because, you know, it started with oncology, and this was because one of the first things we chose to do is what I call one of the great challenges and grand challenges in the world. People don't think that cancer is the #1 reason of death in this world. Cancer is #1 cause of death. So we started out on that grand challenge around oncology, and then I'll broaden it to healthcare. But when we started on oncology, the whole idea behind this was the beginning of personalized medicine and what you do. So now, to date, Watson has ingested 300 journals, every edition, 200 textbooks, all of them, 23 million articles, every clinical trial, which is a big deal. Only 4% of people ever really get treated with a clinical trial. And they're available, but you have to have the data. So he's been fed all of the info on clinical trials and all their results. So at this point now, you've got Memorial Sloan Kettering, who's really developed the advisor, how to make a decision about treatment and diagnosis. MD Anderson worked on the blood cancers to do the same. Mayo Clinic, though, now has done a matching for clinical trials. Cleveland Clinic, how to teach doctors. And the New York Genome Center is all about how to do take the genome and what you get out of that. And you're going to see some more announcements on that next week.
So it sounds amazing.
So that's Ginny Rometty. IBM is roughly about a $100 billion company. We recently announced the formation of a health unit vertical so that we can continue to expand and go forward in these particular aspects. She happened to be speaking from Warren Buffett's show that he puts on down in Omaha. And as you know, Warren Buffett has a tremendous position in IBM, and so we took Watson and this work down to showcase it for him. I do think that these advancements like this need companies like IBM, if I could step out of it for a second, and it is my business and I have responsibility for it, but you need companies that have sticking power. The industry is littered with tombstones of small companies that just didn't have enough to be able to get over that edge. And it's very difficult. There's a lot of money on the sidelines right now with private equity looking for different opportunities. I would suggest that if you have the sticking power and you can find a company like IBM that can back you and work with you on these things, then the opportunity to get to a point where it's commercially viable and it gets embedded in workflow and process becomes a reality. And that's why I'm so excited about the work that we're doing in Rochester, because we are trying to do that, create this ecosystem, this incubator of small innovation, whether it's high performance computing, the Smarter Cities grant that we just did, some of the other great work that's going on, taking Watson into the great institutions like the Simon School of Business, asking, can you fall in love with the question and challenge yourself? What is that question you want to fall in love with? That's how we can make a difference here. So we've made a strong commitment to be able to get into this market. I'm really pleased with the progress that we've made over time. And we believe that this type of technology can, in fact, applied appropriately with the physicians, with the caregivers at the right point, can reduce the amount of time from discovery to treatment to outcomes. And we're going to continue to work on the big data sets, make them available out into the open market, so that when your real smart students come in and they say, we want to study stuff on population health, can we see what the data sets could potentially be, and start asking those questions. Fall in love with the question, not the answer. Allow then the systems to be able to extract that data against these large databases in a knowing system, and then look what the options are. It certainly is a better way to do it than the way that we've done it in the past. So let me stop there. I know it was pretty quick. An awful lot of work and energy goes into this, Watson, but I really appreciate the opportunity to be on this just very enriching day and in this panel. Yeah, thank you. Absolutely. Yeah, thank you. So we've got a little bit of time if you'd like to get at any questions you might have.
Put it into a time horizon, please. You know, when you know somebody shows up in Ralph Mueller's hospital, you know, will this be a tool which is routinely employed? Is it a generation away? Is it a year away? When will it become part of our daily existence?
Yeah, thank you. So, very real scenario. My assistant, who's been with me for 15 years, her husband had a blood disorder. They noticed it because his red and white blood cells, platelets were down significantly. He went to the University of Chicago. It was a very rare disease. They said they only see 1 in 100 that look like this. I immediately called MD Anderson, and we got her down, got him down. And MD Anderson not only confirmed it was very rare, like University of Chicago did, but they had identified the 3 chromosomes that were attacking his body. And they said, look, here's the treatments, here's the clinical trials that we have, and because we caught it early enough, we think you need to have a transfusion and then a bone marrow transplant. And we can do the matching here, but it was through using Watson technology with the analytics that it identified the 3 chromosomes that were attacking his body, and they could actually put him on a chemotherapy plan that could start to arrest it. Now, where he is today is that he has to go in for a blood transfusion whenever he starts to go down. But they know exactly what they need to do to get him back up, and he's leading a very healthy life. So, David, to answer your question, depending on how quickly and how well we define what the problem is, and then the questions we start asking ourselves, MD Anderson went fast. I will tell you, at Memorial Sloan Kettering, it took us a while. We burned a lot of docs' time. We paid the docs collectively, nurses' time. We had to work hard to get the unstructured data in with the structured. 80% of what we're learning is coming from the unstructured data elements. And so it requires a fair amount of a commitment into building these data sets and the data models that give you this information. Once we have those, the ability to extract the data off of the volumes of data that's available to us in journals, et cetera, is very easy. And then you can dial them. So, for instance, if you end up seeing a pandemic, you see influenza, the New England Journal of Medicine isn't going to help you too much if you start to see this showing up on the shores in Mexico or in Florida. You'll start to see these things. And so what you'll dial up is your tweets, you'll dial up your blogs, you'll dial up the news, you'll dial up additional other types of information, just like the CDC would, and then get it into being able to identify. We actually did that in Mexico, and Mexico unfortunately had one situation where they lost 13 lives. The second time they had it, we were able to identify it early, lost no lives, and were able to get the vaccines there in time so that they didn't have any fatal occurrences. So it really depends on what you're trying to solve. We've gotten better about how we look at the use cases and be able to go faster, and we're now making the corpus of Watson available. There's 10,000 developers now that are building work. We found some partners here with Epic. As you know, we have an exclusive relationship with Epic on some of the work that we're doing, especially with the DoD. And then Apple, you probably saw the exclusive relationship that we have with Apple on Health Kit and Research Kit. And it's interesting. Mm.
So it feels like, given your assistant's experience, that it's an exit from the normal workflow.
Yes.
To go to the Watson library, to get the information.
Right.
Is that the way we will experience it for a while, or do you see it being more integrated into the workflow? And what might be the
Well, I think a couple of things. First of all, this advanced analytics, it doesn't have to be Watson. There's many things that are going on. The Care Consideration Library for Kaiser is the largest that's out there today. So some of it's just using this and then applying some analytics to be able to help you do a better job of making these kind of decisions. But for the most dire and the most difficult diseases, as Jenny was talking about, when you apply Watson, it goes much faster. The amount of time that it takes to be able to come to some kind of conclusion or recommendation gets you on a treatment plan that's much sooner. So I do think the larger delivery systems will pick these areas where they have specialty and apply their most advanced thinking. So for instance, if we got into neurology at Rochester and some areas that we feel very comfortable and confident, behavioral health is another aspect, which is a great unwashed. 44 million today is what's identified that have behavioral issues. We know that is far less than what's there today. And so many of that comes out on unstructured data elements. Those are the kind of problems and challenges that are good for Watson to go look at. Because it allows you to be able to look at these vast data sets. Doesn't matter whether it's structured or unstructured data. And then it's how you kind of phrase your question, fall in love with the question versus fall in love with the answer. So there's obviously other industries that we're paying close attention to, working with banking, retail, a couple other areas that are on the forefront of changing medicine. The idea to have Watson embedded with your health plan or with your provider by which you engage with your own health with something that happens is something that we're exploring now with some of the delivery systems, the health plans. So they know what's in your electronic medical record. You identify, I've got, you know, could be a woman that's pregnant, could be pregnant, goes out and has pizza, stomach starts to growl a little bit. Cleveland Clinic's actually already come up with the idea on your cell phone to be able to do an ultrasound. Watson could be on the other side of that, and then it would not have to be handled by, you know, even a physician. It would be, here's what we would think you would go do. And then you could make that decision as an individual as to what you want to do. So it's literally changing and hopefully helping people practice at their practice patterns and their top of their licenses. So.
Yep. Dan, so I'm from the National Institutes of Health, so I was just wondering, and you know, it sounds like an unbelievable data set, resource. Have there been discussions where some of this could be available through, you know, the NIH investigators?
Yeah, and actually the home of Watson is just over here at Astor Place, so we've got a brand new building and all sorts of interesting people that are over there. We're going so fast, and what's happening is people are looking at the commercial side of it, and what we've done is it's kind of a three-step process. It's been about $250,000 for an entry to go in and do the use cases. Then we stand something up and make sure both companies and organizations like it, and then you set up a working system to be able to do that. we're just struggling with mess kits right now to get the skill sets. We have to train the universities. We have now 10, I think 15 universities on cognitive computing, this most advanced type of thinking, embedded in their curriculums, and we're just making the technology available. So these areas that you're talking about, definitely we've got groups working with the federal government on some of these areas. You can imagine what the federal government thinks about this type of technology when some of the challenges that unfortunately happened here that we could identify through different patterns in a different way. So we would love to continue to have those conversations, just a matter of how quickly in the teams. But we're hiring like crazy into this, and we're trying to work with the universities. That's why I wanted to go to the Simon School of Business and present this to the students and see what they did. And David was with me. The winning team was the team that studied it, and they came back without me telling them to fall in love with the question. They said they spent 75% of their time asking themselves the question. And when they came back with what they thought the answer would be of how you would deploy it, it was absolutely the winning aspect versus somebody else that happened to go to flight. They had a great flight background, and he wanted to tell us all the answers. So he was actually using the tool to complement himself with everything he knew. Sounds like the cowboy of yesterday in medicine versus the pit crew that we need going forward. And David and I saw that, and then we started to work on curriculums, cognitive computing, and make these corpuses available, and start really rethinking how we train. That's why we're using Cleveland Clinic and Toby to help us with how do we